Welcome to This Explainer. Today, we're diving deep into what is essentially a stealthy biological thriller, one that has literally plagued humanity for centuries. We're tracking typhoid fever. We'll trace its path from a microscopic, entirely unseen threat all the way up to a massive global health challenge. Now, millions of cases occur worldwide every single year, especially in regions where sanitation and clean water are limited. But to actually defeat this thing, well, we have to understand exactly how it operates. So what happens when a single, innocent-looking sip of water turns into a stealth attack on your body? Tracing how a microscopic pathogen from contaminated water manages to wreak such absolute devastation inside a human host is crucial. Because, guys, this isn't just a simple infection. It is a highly coordinated invasion. The disease spreads mainly through the fecal-oral route. That means the danger often hides in our absolute most basic necessities, our food and our drinking water.
To get the full picture, our journey today takes us through 5 steps. 1. Meet the silent invader. 2. The body under attack. 3. Diagnosing the threat. 4. Treatment and drug resistance. And finally, 5. Prevention and global health.
Let's jump right in with part 1. Meet the silent invader. Unmasking Salmonella Typhi. Zooming in to the microscopic level, our main antagonist here is practically engineered for survival. The bacterium is formally known as Salmonella enterica Typhi, or, just Salmonella Typhi for short. It's a gram-negative bacillus, which basically means it's wrapped in a super tough outer membrane. It uses these little tail-like appendages called flagella to physically navigate through our system. But its absolute secret weapon is the Vi antigen. It uses this antigen as a literal biological shield to completely evade our body's initial immune response, allowing it to just slip past our primary defenses totally undetected.
And this brilliant yet terrifying survival mechanism is exactly what created the infamous historical case of Typhoid Mary. It perfectly demonstrates how completely healthy-seeming people can unknowingly become massive vectors for spreading the disease. What happens is, some people recover from the acute illness, but the bacteria sets up a permanent base camp in their gallbladder. From there, they just continuously shed the bacteria into the environment, completely without symptoms. As you can imagine, this makes tracking and containing the spread incredibly difficult for public health officials.
Moving on to part 2, the body under attack. The stealth invasion.
Once this pathogen gets past your lips, the real battle begins. And it doesn't just attack our cells from the outside, it actively uses our own immune macrophages as Trojan horses. So, step 1, you ingest the contaminated food or water. Step 2, the bacteria somehow survives the harsh acidic environment of your stomach. Step 3, it reaches the small intestine and invades the tissue, specifically targeting these areas called Peyer's patches. Step 4 is where it gets crazy. It gets swallowed by our macrophages, which are the immune cells supposed to destroy it. But instead of dying, Salmonella Typhi comfortably multiplies inside them. Finally, step 5, it uses those cells to stealthily cross into the bloodstream, a state known as bacteremia, and then it spreads to the liver, the spleen, and the bone marrow.
Now, if left untreated, this disease follows a really rigid, suspenseful 4-week timeline. In week 1, you might honestly just think you have a normal flu, a gradually increasing fever, some fatigue, maybe a dry cough. But by week 2, things escalate drastically. Your fever spikes, your liver and spleen enlarge, and a distinct pink rash called rose spots might pop up on your chest or abdomen. Week 3 is the danger zone. This is when life-threatening medical emergencies hit. Severe delirium, massive intestinal bleeding, or even intestinal perforation, where the bacteria literally causes ulcers that tear a hole in your intestines, leading to peritonitis and sepsis. Finally, week 4 brings a gradual recovery, but obviously only if the patient survived that 3rd week or finally got treatment.
Which brings us to part 3, diagnosing the threat, identifying the invader. So the bacteria is multiplying in the bloodstream, and the clock is ticking fast. But there is a massive point of confusion out there in clinical settings regarding diagnosis. While the Widal test is widely known and really easy to access, it actually measures antibodies, not the bacteria itself. That means it has serious limitations and can easily produce false positives. International clinical guidelines are super clear here. The blood culture is the absolute gold standard for early diagnosis, especially during that crucial 1st week. Finding the actual bacteria in the blood is really the only way to be 100% certain. And because early symptoms are so notoriously vague, medical professionals have to actively play detective to differentiate typhoid from other serious diseases like malaria. If we compare the two, you'll see typhoid is bacterial and features a gradually increasing fever and those distinct rose spots.
Malaria, on the other hand, is parasitic, and it presents with sudden intermittent fever spikes and severe sweats. Hitting the nail on the head with this distinction immediately dictates the entire course of treatment, so doctors absolutely have to get it right.
All right, part 4, treatment and drug resistance, the mutation counterattack.
Once the diagnosis is locked in, modern medicine launches an immediate counterattack. But like I said earlier, this is a biological thriller, and the bacteria is learning to fight back. We can't just guess which drug to use anymore. Effective treatment today means analyzing that specific blood culture to see exactly what the bacteria is sensitive to. This ensures clinicians use the right weapon, like ceftriaxone or azithromycin, for the exact bacterial strain they're fighting. Utilizing local resistance data is absolutely crucial so we don't accidentally prescribe a drug the bacteria has already learned to defeat.
And here is the genuinely terrifying part: the global rise of multi-drug resistance, or MDR, and extensively drug-resistant XDR mutations. XDR typhoid is particularly alarming because it evades almost all of our standard oral and injectable treatments. If we don't practice strict antibiotic stewardship, which just means only using antibiotics when absolutely necessary and always finishing the full prescribed course, we seriously risk turning a highly treatable infection back into the fatal, unstoppable disease it was before modern medicine.
Finally, part 5, prevention and global health, building the shield. We spent a lot of time looking at the micro level. Now it's time to zoom out to the macro. According to the CDC and UNICEF, the most powerful interventions we have aren't actually found in a pharmacy. They're found in engineering proper sanitation infrastructure. The absolute bedrock of prevention here is WASH protocols: water, sanitation, and hygiene. Ensuring access to safe drinking water and proper sewage disposal cuts that fecal-oral transmission route entirely. But we also have a biological shield: the typhoid conjugate vaccine, or TCV. This is highly recommended especially for kids in endemic areas and for travelers, because it provides long-lasting immunity before the bacteria even has a chance to invade.
As we wrap up this explainer, I want to leave you with a bit of a provocative reality check. Everything we've discussed today, from that sneaky via antigen shield to the devastating intestinal complications, is entirely avoidable. Typhoid is 100% preventable. We have the vaccines, we understand exactly how it transmits, and we know for a fact that safe water and sanitation are the ultimate cures. The fact that this ancient invader still persists today is largely a question of health equity. So, it leaves us with one final thought. If the science is clear and the solutions are proven, are we actually ready to commit to making clean water and proper sanitation a global reality for everyone?